most famous physical therapist on the internet.
Hi, folks. I'm Bob Shaw, physical therapist.
Brad Heineck, physical therapist.
Wake up, Brad. Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to talk about sacroiliac self-treatment. There's 5 that we're going to show you, 5 ways to do it at home, options to fix that SI pain.
That's right, Bob. It's we're not only going to show you to fix it, but we're going to help you self-diagnose it to a certain degree. And we'll talk about that so you have a good understanding of it.
All right. I can't wait to see what you're going to say.
Say no more,
By
Bob.
the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Go to bobandbrad.com and go to the giveaway section because starting tomorrow, we're going to be giving away a Sleep Ovation mattress.
That's right, Bob.
This is a sample of one. This is not an actual full mattress. And you can see it's got 700 tiny mattresses that provide airflow and really extreme comfort.
Right, backed up by nice coil springs. We love ours. There's absolutely no doubt about it.
All right. Also, they're going to give away a couple pillows. So go to Bob and Brad, go to the giveaway section, and you can sign up for it. You can also go to Facebook, sign up for it there. It'll be pinned at the top of the page. Go to
Oh, sorry.
You go to TikTok or Instagram. Our camera woman's telling Brad's mic is off. Or which one am I missing now? Instagram, TikTok, and Twitter.
They got it. These people
are a 60-second version of our program. All right, enough of that.
Yeah,
Brad, I'll haul these out.
That's right.
And you can go ahead and start.
Okay, so SI pain or sacroiliac, it's one of those terms that I think a lot of people aren't really sure what the sacroiliac is. So we're going to go through that. I remember as a child, my mother talked about the sacroiliac, and I'm sure she didn't really know what it was either. But it was fun to say.
A lot of people think it's the back pain.
Yeah, and it's all related.
It's kind of.
But it's very specific, and it's right here, and you have 2 of them right here and right here. Now, if we take everything off, the clothes, the skin, the muscles, and everything, we look at the skeleton.
So he's facing this way,
right?
Or she's facing this way.
So we got this side of the pelvis and this side. This is actually called the ilium. This bone is called the ilium. Okay, the pelvis is made up of 3 bones. This is one of them. We're not going to get into the other 2. And then we have the sacrum. And then there's a joint between the 2 where the bones connect, but they're not fused together. There's actually a joint there, but there's very little movement in it. Yeah. There's a lot of very aggressive ligaments and muscles holding this together.
Heavy ligaments.
Right. So sacrum, ilium, so it's called a sacroiliac joint. And that can be a source of pain on either side. Again, if there is movement in there, it's actually designed not to move. There is a little controversy in this.
There's a lot of controversy in this.
But we're going to approach it with that so it's easier to understand. And it's really hard for me to even show movement on this model. But if the ilium is rotated one way or the other, it puts stress on the joint and can cause pain. And we need to relieve that stress.
Right. And I think a lot of times that movement can occur from stresses being on the ilium for a long time. Like if you're sitting wrong, or it could be a abrupt jarring.
Exactly right, Bob. Some examples, let's say you fall and you land on your sit bone, which is part of that pelvis structure. It can put that rotation on. Another common one is like taking a step off of a higher step and landing abruptly.
Yeah, really jamming, and it's going to go all the way through the leg, and it's going to move that ilium one direction.
The birthing process really can put a lot of stretch, on that joint because of obvious reasons. I had a student in my therapy class. She was a gymnast in the college level, and she had continual SI pain because her land, when she dismounted and landed, even though there was cushion there, repetition, and she'd been doing it for years, and it was a common problem for her.
But I'm going to throw one in there that could happen over time, Brad, and that would be sitting like unusual. Like let's say you sit on one side all the time. Like even if you cross your leg and you're always got stress on kind of one.
Like this.
Ischial tuberosity, which presses on the ilium. So there, weird things like that can also cause the rotation to
Right.
occur.
So the symptoms typically are increased pain with walking, usually with walking longer distances. It gets worse. Weight bearing, if you're standing on one leg, if it hurts and then you shift to the other one, not so
feels better.
bad. It feels better. That's another symptom. Is there any other ones we're missing, Bob? Usually it feels better when you sit down.
Right.
Take weight off of it. This
might
is,
be worse with hills and
right.
steps.
Walking up
Yeah,
and down.
because you're, again, jamming it a little bit more.
Now, word of caution, these symptoms just happen to be very similar and they cross paths with both hip pain and back pain. So they're all the same area and they can refer pain to different areas. So this is not a very easy
Yeah, do you remember that one,
diagnosis.
was it Fortin's sign, where you actually just turn around and if you actually point to the spot where the
Right.
pain is,
Yeah.
and then take your hand away and then point again and hit the right same spot, that was the sign that it could be SI point.
Sure.
Pain. But it was generally, right down to the pelvis here.
Right.
So
I do want to say you can get referred pain down the leg with SI pain.
yes, you can.
Typically not past the knee. If it goes past the knee down to the foot, then it's probably from the low back.
I've seen it in the groin and down the front of the
Sure.
thigh.
Yep.
So it is a problematic one, and I think it's easily misdiagnosed by professionals all the time.
Right.
So.
Sure. You may get a crisscross diagnosis.
Right.
One thing's for sure is these treatments that we're going to show you, if they work, they're going to work, but they're not going to cause any pain.
Any problems.
As long as you follow the simple instructions that we're going to give. Should we go with the first one?
Yeah, all these, they should not increase your pain. They should decrease your pain. They should feel good. If they do that, you're on the right track.
Right.
Even if it is an SI problem, you're on the right track then.
Exactly right.
That's how we roll, right, Brad?
Exactly, Bob. So, Bob, I personally have right SI problems, and
Sure.
I've been dealing with it for years, and this is one of my go-to exercises that almost always works. I put my foot up on a stool at home.
A fairly high stool.
I've got a step, that's outside where it's a kind of a brick tie wall thing that holds in some of the landscaping. And I go like this, and I just push, and what that does is that puts pressure on that ilium joint, and it makes it feel better. And I can always feel, it always feels good while I'm doing it, and when I get done, walk around, it feels better than it did before. Now, if you try this, and it seems like it hurts, and you get done, and it still hurts afterwards, don't do it anymore.
Right.
That's done. That's the red flag.
You might try the other side then.
Exactly right, Bob.
But I also, Brad, would probably suggest that doing this on the stairs with a railing would probably be the best way to start off with.
Yep, right.
So
yeah, especially the first time you do it.
Right. It's going to give you stability, and you don't know what the pain's going to do, and if it gets worse.
If you do it and it feels good while you're doing it, you can put a little more pressure on it, but not a lot the first time.
Yeah, you see that Brad's almost doing a little bit of rocking motion there when it feels good.
It feels good right now even when I do that. So take your time with these.
Just curious, Brad. So if you do the opposite leg, does it make it worse?
No.
It doesn't. Okay.
No. And I
make it better.
I haven't really done the opposite leg too much because it takes care of it, so I'm done.
Sure.
You know what I'm saying? I've got other things in my mind. The next one, number 2. This is laying down.
Lying down.
And this, you can do this in bed or on the floor. It really doesn't matter. In my case, I'm gonna bring my right knee up because my right side is the bothersome side. I'm going to pull my knee to my chest. And now there's 2 ways to do this. I want to hold my knee and I'm going to push as hard as I can against it. So it's hip extension. Not that you need to know that, but I'm going to hold, and it's an isometric. This is called a muscle energy technique. And I'm going to hold and push and hold that for about 5 seconds and relax. Now, when you do that, if it feels better, it feels like good pressure, that's gold. That means you can continue. If you do that and it irritates it, then you stop. You're done with it. That's not an option.
Then again, you might try the other side.
Yep.
And see if that one works for you.
Right.
Again, this is always an experiment. We're always trying to see what works, what position works for me.
Right.
And when you find that, that's the one you're going to keep repeating.
Now, the other option doing here, you want to grab the booyah stick. You can use a booyah stick. You can use just about anything.
A broomstick.
A broomstick. You could actually use a baseball bat. Would work out good. You're going to put it right between your knees, and I'm going to push this way with this leg and the opposite direction with the other knee. I'm going to hold the stick still though, and we're basically an isometric. Is very similar to what we just did. It's just a different approach. And I'm going to hold. Go for that 5 seconds and relax. Again, if it feels good, we're going to continue to do it. You may do it up to 3 times. If it hurts, you're going to stop. If it doesn't feel like it's doing anything, you may want to, either way, you're going to try and do the
opposite side.
Yep. So you're just doing the opposite forces on each knee.
Sure.
So
now, Brad, a lot of times after people have done that, we have them also put their hands between their knees and squeeze them together to reset the pubis. You know.
Yep.
So, Brad,
have you ever done the fist?
Yep, the fist would work. Yep.
Fist your hands.
Yep.
You squeeze like you're trying to squish your fist.
Just do that 5 seconds, 3 times, and you might feel a little click in your pelvis even, but it just kind of resets the pelvis.
Sure.
So. All right, Brad, what's next on the agenda?
The tennis ball. You can't go wrong with the tennis ball. Now,
we're going to move this out of the way, right?
Yep. This, you can use the floor. Oh, I thought you were going to do that by yourself, Bob. The floor
you can use the floor
or the wall.
Or the wall.
Now, in my case, on my right side, if I just go up against the hard wall and I push the right side, right where that SI joint is, put pressure on it, always feels good, even right now. It feels good, a little mobilization. Sure. But if I take the tennis ball and I put it in the right spot and put pressure on it, it even feels better, and I'll roll up and down on it. Again, the same rules. It needs to feel better while you do it. And if it doesn't, it's not the right thing to do.
This is one of the things that I've found throughout my career, by the way, is that I become so much better at treating a problem when I have it.
Yeah,
I mean,
exactly.
You work through every little idiosyncrasy of it, and you figure out what works, and you also can relate to the patient. So we just need to get every problem, Brad, and that way we can, learn how to solve it.
Exactly, Bob. I know what you're saying. Now, you can also do this on the floor, and I'm just going to briefly, it's the same thing, but you're laying on it. You would not do it on a bed. Have to be a hard floor or a carpeted floor, and then use your body weight, and that works out well. The last but not least, now this option, you do need to make a purchase, but it's a good purchase. You can use, and some people have these. They're very popular now.
Right.
These massage guns that reciprocate. And this happens to be one we like. We promote this one so much that we put our names on it. So if you want to get a Bob and Brad massage gun, there's one right here, and they work very well. That's why we put our names on it.
Very high quality at a very good price.
Here's the little box it comes from. That's a beautiful little.
I just have to repeat, Brad. When these first came out, they were going for $400 and more, and we would not sell them because of that. We would not show them. We'd not even demonstrate them because we thought it was too much money. Now this is down to, I believe, $130, and that's without a coupon. And usually we have a coupon going. I don't know when you're going to watch this video, but sometimes as much as $40 off. Or $50 off even.
And you can use them on muscles all over your body. But for the SI joint, it's important. You're not going to put this head on for the SI joint. That's for getting into some soft tissue, some muscle. I have the airfield tip, which works really nice.
Yeah, that one's a comfortable one to use.
Yeah, you can actually push on it. Because the SI joint, it's pretty bone right there. Unless you're a pretty heavy person, you're going through a little skin and right into the bone. And let me get this going again. You got to hold it for 3 seconds. So, and I'm just going to work this right there. Oh, it feels good.
So he's right over the ligaments. He's getting some more blood flow to it.
Yeah. And I'm going to work these muscles around here too. Again, this feels good. While you're doing it should feel good. After you're done with it, should continue to feel good, and you walk around and have positive results. The nice thing about this massage gun is you can work your SI joint, and as soon as you're done with that, you can go to your hamstring and work that, or your quadricep, or any other tight muscle you have.
I've been using it on my legs a lot.
Yep.
My arms are doing okay, but
There's a reason why these guns are becoming so
popular,
popular, because they work. And of course, the Bob and Brad one is my favorite.
that's the best of all. All right.
Anyways, very good. Good luck with your SI curement.
Curement.
Is that a word?
No.
Oh, well, it should be.